Thank you for being here today. We have a full, like I think 17 or 18 people signed up for this, and it is being recorded. So if something came up or something, I'll send it out to everybody that has registered. But I'm so excited you're here today. This is truly an exciting initiative that we've never done before. And so I'm excited for your feedback. A couple things about me and how I present is I'm a little bit more casual. I don't have my video on because I have, my 7-year-old is doing hybrid school, so he's home today, and it usually helps with like videos and internet issues and things like that. So a little bit of housekeeping. I am recording this. You will get the recording. You will also get a PDF of the slides. Feel free to ask questions in the chat box just so you don't forget. And then I'll go through that at the end, or feel free to just say, hey, Megan, I have a question, hold up, on a certain slide or anything like that. You should be allowed to talk now. You just need to mute and unmute yourself. If for some reason I were to lose internet or anything like that, I will try to log on with my hotspot. If I don't log on in the next like 10 minutes or 5 minutes, something must have happened and I couldn't even do that. So what I would do is re-record it for you all and send that out and send you an email right away. But I don't think that'll happen. So we're gonna go ahead and get started. First, I have to give a big thank you to Delta Dental. It was through funding through Delta Dental that we were able to get this grant and work on this project with you all today. And then another huge shout out to IDPH and Angie especially, who is going to say a few words in a moment, but IDPH has been a phenomenal partner for us in a variety of different ways through their maternal health. And so it was really with this project and reaching out to Angie and saying, this is what we want to do. How can we work together? And it has been nothing but fabulous. So thank you, Angie. And I'm going to let you talk for a little bit and then I'll start the presentation.
All right, thanks, Megan. So I just wanted to say I've been working with Megan and this program is amazing. So I'm really excited for everybody to get to hear about it today. I was surprised how much you can do by just, reaching out to one client. But I did also want to add that I know that every agency is different when it comes to serving maternal health clients. So please share this training information with staff who see maternal health clients so we can reach as many families as possible. You'll see once you go through the training here how much of an impact you can make. So that is all, Megan.
Awesome. Thanks so much, Angie. And with that, we're going to go ahead and get started. If you're just joining us today, I just wanted to reiterate that when you entered, you were not allowed to talk, but I have since changed that. And so I have unmuted you. And so you just need to make sure you mute yourself again, and then you'll have the functionality to mute and unmute as you need. And what I was saying is feel free to ask questions as we go. If you put them in the chat box, I'll look at those at the end and we'll review those. But otherwise, I'm more than happy to take questions as the slides come up if you're thinking of something right then and there. So just a little bit about me. I am the Associate Director of Programs with Healthy Birthday. My contact information is on the slide right there. I would love to hear from you. I love hearing from people that are doing this in their communities and sharing ideas and how it's going and feedback, because that's truly how we get better and grow. And so I appreciate hearing from you. I love to hear from you. So please don't hesitate to reach out to me or Angie for that matter of any questions that you have as we go through this or as you start implementing this into your system. I have been with Healthy Birthday for just a little over 15 months. Previous to that, I worked for actually Iowa Department of Public Health as well. Angie and I never connected, which is odd because I worked in tobacco cessation, and you all know how important not smoking is to your teeth or not using tobacco. And so I was actually in the tobacco division for about 4 years. Prior to that, I was in the nonprofit doing tobacco work as well, tobacco prevention work. And it was really towards the end of my time at Iowa Department of Public Health when I really started focusing on maternal and child health and, not smoking not smoking while pregnant, especially in the 3rd trimester, and looking at smoking rates and creating programs and marketing plans for that. And then I also have 3 children of my own. I used Count the Kicks with 2 of them when the app was out and knew about the importance of tracking fetal movement, but I really didn't know the why behind it. Nobody really talked to me about it. My midwife at the time, she had just said, at 20 weeks, have you felt baby move? And that was about it. And so when a position opened up at Healthy Birthday, I said, that's for me. And I love programming. I love doing these types of webinars and presentations and talking to you all. And so I'm excited to be here today. So I'll do my best to get you out here in an hour. It is a longer presentation. We have some videos to watch. So, but I think you'll find it hopefully very educational and informative. So we're going to try something. First, I would love for you to share with the group, and especially me, what your role at your health system is. What county do you serve, or counties, through where your iSmiles program is through. Go ahead and just enter that in the chat box. That just gives me a good idea of geographically who is all here today. And so I'm going to just check. And then while I do that, while you're doing that, I'm going to pull up a poll. And this poll says, have you ever heard about Count the Kicks before? So let's see if this works. So you should be able to answer this question. It should have popped up on your screen. Great. I see some of you got it. Perfect. I'll give you just a couple more seconds while I check the chat box. All right, so several of you serve multiple counties. Awesome, you guys are busy. Cool. Amber, you serve a lot of counties. 3, okay, cool. I'm gonna end polling so you can see the results. So pretty easy. It looks like the majority of you have heard about Count the Kicks. To what extent, I don't know, but I'm hoping that this presentation does a number of things for you. One, if you just kind of know the basis of Count the Kicks, hopefully this will give you more information and background. Maybe you know about Count the Kicks because you used it with your own pregnancies, or maybe you know about it just from media or things like that. Wherever you're coming from when you have that knowledge, I'm hoping this expands your knowledge and gives you a better idea of how you can truly integrate Count the Kicks into your practice and system. And so first I'm going to play a quick video. And what this video does is it really gives you a good idea, a little bit more about Count the Kicks in general, the importance of sharing Count the Kicks, and how that mom-to-mom sharing is so important. This aired on Good Morning America in 2017 with baby Ruby. She was saved when her mom noticed reduced fetal movement. She spoke up to her provider, and you know, the provider then went through all the necessary steps to check if baby was okay, the biophysical, non-stress tests. And what they found was in the ultrasound that baby was not moving any of her extremities, not her fingers, not her toes. And so even though I think she was like 32, 33 weeks along, they said, we need to get baby out now. And so she had an emergency C-section, and what they found was the cord had been wrapped around Ruby's neck 3 times, literally cutting off circulation to her extremities. The doctor, Dr. Monsager, who delivered her, who's also on our medical advisory board, had said if you had waited, you know, a few more hours, it would have been a totally different outcome. And so hopefully you can hear this video. Go ahead and just interrupt it if you can't hear it, but I just like to share this before we get started.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, Ruby, and by raising awareness, she may end up saving many more.
We're going to turn now.
All right. So I think that just, can you still hear me okay? I had a weird audio issue there. But what I think that video really does is that does a good job of showing, you heard the reporter at the end saying how much the app downloads have increased. And we have seen that time and time again when we share baby stories with, baby safe stories with on social media or with other moms, is we really see that jump up, and that's truly our hallmark tool that helps moms understand what's normal for their babies. So it's probably one of the most important things you can do when you're talking to your moms is talk to them about the importance of tracking baby movement. Here is an easy and useful way to do so. And I'm going to talk through some features of the app, but then I'm also going to talk through if you have an expectant mom who does not have access to a smartphone or Wi-Fi or broadband issues and things like that. So Count the Kicks is a highly effective evidence-based stillbirth prevention campaign. We did not invent kick counting. The founders did not invent kick counting, but what we did invent were the tools and resources for providers, community agencies, social service agencies to have that kick counting conversation with moms, and the tools and resources for moms, expectant parents, to understand the importance of fetal movement monitoring, and then how to speak up and why to speak up if they notice a problem. The campaign is ready to go and low cost. We have branched out into 10 other states that we contract with, but by far our focus is in Iowa. That's our backyard. This is where we began. And so this is where we really truly spend a lot of our times. But overall, our goal is to save 7,500 babies a year. And so in order to do that, we need webinars like this and people like you who are willing to go out and share this information. So before we get too much further in, I think it's really important to understand just some definitions and facts, because over time, as I do these, I find that there's some variation in thoughts of what stillbirth is compared to especially infant mortality. And so just so we're all on the same page, a stillbirth is a loss of a baby after 20 weeks of pregnancy. It's further classified as either late term, early, late, or term. An early stillbirth is a fetal death occurring between 20 and 27 weeks. A late stillbirth occurs between 28 and 36, and then a term is occurs between 37 or more completed pregnancy weeks. So on average, we are actually losing around 24,000 babies every year to stillbirth. And if you look down a little bit further, infant mortality is death of an infant before his or her first birthday. On average, we're losing around 22,000 of infants. So that's where you hear about like why SIDS is so important, or SIDS prevention is so important and things like that. And the reason I tell you this is because stillbirth is just as prevalent as infant mortality, yet nobody talks about it, and nobody talks about it to the extent that we're talking about infant mortality. And I'm not saying that to underscore infant mortality at all. It is absolutely very important and we need to talk about it. But what we need to do is we need to talk about both at the same extent. I remember when I was pregnant, even like when I went into the pediatrician, or, you know, as I was interviewing pediatricians and things like that, or my own doctor was talking about it, there was so much information about SIDS. I mean, it was overwhelming. It was scary even, you know, like all the things you're supposed to do, back to sleep, in their own space, no co-sleeping, et cetera, all very important and valid. And we have seen success with the Back to Sleep campaign, this infant mortality, SIDS has dropped dramatically over the years. And so we want to see that success with stillbirth, and we want providers to know, we want you to know, it is okay to talk about stillbirth prevention with expectant parents. In fact, it is very important to talk about it, because you have an opportunity, just as Angie mentioned in the beginning, to literally save a life. And I'm obviously on social media, and I share a lot of the Count the Kicks posts and things like that. And I got contacted a few months ago by a friend who I knew through a previous job and things like that. And she had said, hey, I never told you, but her son, who was now at the time like 3 months, was like, I saved my baby using Count the Kicks and noticing reduced fetal movement because I saw your post. I mean, it's just amazing. And she had said that she didn't actually use the app, but she noticed reduced fetal movement throughout the day, and she called her provider. She just knew something didn't feel right, and she said she remembered several posts, because I share a lot of them, and it really pushed her to say something's not right, I need to be seen. And baby Everett was born safe and sound about 4 or 5 weeks early, and he was very anemic, and that was his issue as to why. And so we're gonna talk more about that in a little bit, but I really want to make sure we understand the correlation and then the causes of stillbirth. And so, just so you know, for your own knowledge, it says, this is one research study, is stillbirth can happen because of pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, medical complications in the mother. If you're really into research and you like that, we're going to talk about it in a little bit, but here is a link to this specific research study, and then just another slide about the numbers. So let's dive into more of the history of stillbirth and healthy birthday and how we got started. Just for your background, in the early 2000s, there were 5 Iowa moms. You see them on the screen. They endured the heartache of losing a daughter to stillbirth or infant death. And then they actually did not know each other at the time. They got connected through friends and pastors. They started having like coffee meetings and things like that, and just grieving together, because even though their providers at the time had said stillbirth, what happened to you is not that common. When they started talking and realizing, sitting right here is 5 Central Iowa women who this all happened to within the span of 9 months to a year, and they started doing their own research, they realized stillbirth is a lot more common than people think. It's 10 times more common than SIDS. It's just as prevalent as infant mortality, like we talked about. And so as they're having these connected conversations and they're going through their grief and things like that, they started thinking, we don't want anybody to join our club. We don't want any more people to go through what we have gone through. So what do we do? And so that's when their conversations sort of shifted to channeling their grief into stillbirth prevention efforts, so that they could keep other babies or other families from facing the pain of losing a baby. In 2004, they worked with the Iowa legislature to create Iowa Stillbirth Registry, which was the most comprehensive stillbirth data collection program in the country. They worked with U.S. Senator Tom Harkin at the time, who's also the author of the ADA Act, to support, with his support in securing CDC funding for the project. And so it was back after they secured funding and kind of became a best practice for data collection that they were asked to speak at a conference a couple years later. And while they were at this conference on stillbirth, they heard a group of researchers talk about a study that had been done in Norway that demonstrated a 30% reduction in stillbirth by teaching pregnant women how to monitor fetal movement during the 3rd trimester of pregnancy, and by doing kick counts on a daily basis. And it wasn't just that. Once they started seeing that, they started finding other research studies that had been done that indicate that kick counting, a daily record of baby's movements, so kicks, rolls, punches, jabs during the 3rd trimester, is easy, free, and reliable way to monitor baby's well-being, in addition to regular prenatal visits. And so they thought, oh my gosh, we found our next project. We're gonna bring this back to Iowa. If they could just save one baby with this, it would be worthwhile. So based on the scientific research, the public awareness campaign that you know about today, Count the Kicks, was literally born in 2008. It was the next year when they created Healthy Birthday in 2009 as a way to kind of help fund the efforts of Count the Kicks message, to get some grants and things like that. And so what they did is they worked with a marketing company here in Des Moines, and they worked with Iowa Department of Public Health to create this stillbirth prevention campaign. And what the founders really wanted to do was they wanted to create something that was empowering for moms, easy for providers and others to talk about stillbirth and stillbirth prevention. And so when you look at the material, it sounds like you're all familiar with it, it's bright and colorful. Hold on, I'm gonna turn this off, sorry. Can you still hear me okay?
Yes.
Sorry about that. Oh, my speaker keeps changing for some reason. Angie, can you hear me okay?
It went in and out there, but I could just hear you now.
I just want to make sure you all can hear me. I'll do the chat box. I'm not sure I can hear you, so you might need to chat. So hopefully you can hear me. I'm going to keep going because nobody's saying anything in the chat like they can't hear me. Sorry about that. My speakers keep changing for some reason. So anyways, and so when you look at the material, thanks Amber. When we look at the material of Count the Kicks, you can see it's very bright, it's very colorful, it has a Dr. Seuss-like feel to it. And what the founders did is they went to Dr. Seuss's widow and said, hey, we are creating the stillbirth prevention campaign. It has a very, your husband's kind of touch on it, it rhymes, has his flourishes and illustrations. Are you okay with this? And of course she said yes. And we even have it in writing that she supports it and is fine with us using any sort of illustration. So I think that's just so cool and so empowering. In 2013, they had a web-based Count the Kicks app created. And then it wasn't just till 2015 when the free Count the Kicks app was available. And then in 2017 was when they hired the first executive director, who's still the executive director today. And then we have undergone from going from one part-time contractor to now a staff of 5 full-time staff. In 2018, we got data from Iowa Department of Public Health with the stillbirth rate. And we have realized that from 2008 to 2018, in those 10 years, so in the decade of Count the Kicks existence, there has been a 32% reduction in stillbirth, which is awesome. And it's right up there with Norway. And so we need to keep that momentum going. We know year to year, the stillbirth rate can fluctuate. That's just kind of how it is with stillbirth rates. It can be, one year can be super low because of, less pregnancies, less deliveries, less people getting pregnant. And then one year it could be super high. Maybe there's a syphilis outbreak or something like that. So we kind of look at data year to year, but we also look at it on the, a trend or several years and averages. And so just a little bit more about the data, because I think it's super important to understand and know, again, how prevalent this truly is. 1 in 167 pregnancies ends in stillbirth. The racial disparities are huge and alarming. Black moms, it's 1 in 94. Black women are 2 times more likely to experience a stillbirth over their white friend or counterpart or neighbor. Hispanic moms, it's 1 in 191, and white women, it's 1 in 204. So again, we just briefly talk about the Iowa stillbirth data. 2018 was the lowest on record for year to year, is 3.9 fetal deaths per 1,000. This is amazing and so fantastic. However, Iowa families still are losing an average of 174 babies to stillbirth every year. That's a lot of babies. And again, the racial disparities are huge. While our rates are far better, we still lose 1 baby for every 109 pregnant Black women. While for white women, it's 1 per 250. And so when we talk about racial disparities, that is across the board, whether whatever state you're in, whatever country you're in, there's huge disparities when it comes to stillbirth, especially among African-American women. And so we ask ourselves, why? Why is this happening? Why is there such a huge gap? And researchers have pointed to the following as causes for disparities. And I don't think these will come as a shock. I think it's really important to understand and know and think of ways that we can bridge that gap so that we can lower that gaping hole. So epigenetics, those physiological variations that are caused by external or environmental factors that switch genes on and off, literally changes of the DNA from generations and generations of being, you know, through history, through slavery and racism and toxic stress and things like that, being treated unequally and or unfairly, literally being an African-American woman in a systemically unjust society, and every single thing that comes with it has led to real and pervasive health issues for Black women, which ties into predisposition for certain conditions, such as gestational diabetes, high blood pressure, so preeclampsia. Experts have said and say that Black women are less likely than other races to receive early treatment to these conditions. Access to healthcare, socioeconomic barriers. We know here in Polk County, there are a lot of women who come into labor emergency department, especially, you know, Mercy here in Des Moines has a labor ED, and they do not have a primary care provider. They do not have a primary care provider. And so what we're going to try and work on is making sure that these women are getting prenatal care before they, when they come in, so we can get them the care that they need. And then research shows education is not a determining factor. A college educated Black woman is still more likely to lose her baby than a high school educated white woman. And so what are we doing to help reduce those disparities in stillbirth? We're continually looking for funding opportunities to focus on this. Currently, I'm working on a grant right now that is working on educating faith leaders in the community, on talking to their community members on the importance of Count the Kicks. We've created some posters and bookmarks and decals for beauty salons, of primarily Black beauty salons. We did a focus group a couple of years ago to kind of just talk to the African-American women and understand more of where they're getting their health information. We know that you know, they weren't, a lot of them are not getting it from their healthcare provider. So where are they turning to? And what we found out was they're turning to pastors and their hairstylists and their grandmas and that generational aspect of it. And so that has helped us plan and prioritize other outreach efforts so that we can truly meet people where they're at. And so we've created a faith-based toolkit. We've created some other outreach tools within the African-American community, and we're just looking to continually expand that and build upon that. We also have our app. It's available in 12 languages. So we have a lot of options for a lot of different people when it comes to our app. And then we have culturally appropriate material and languages. I'm going to show another quick video. This is from Kimberly Noble Piper. Angie, I don't know if you know her, but she also works at IDPH. She is a fantastic woman and a longtime supporter of ours. She is the executive officer for the Center of Congenital and Inherited Disorders. She also is the project director for the Iowa Stillbirth Surveillance and Prevention Programs. And so this, what I really like about this story is she says some key words and key sentences, but she also has that experience of being a labor and delivery nurse before coming to IDPH. So she has that connection to knowing what it's like to deliver a stillborn baby, and something that, you know, we think about, it affects the family so much, but we don't think about the medical providers it affects or the community and the economy. And so it's truly an intersect between all of these different areas when a baby is born still. So let's see if you can hopefully hear her.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families, as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements, and that baby.
I'm going to send you that link so we don't spend time trying to figure that out. Technology does not like me today. My apologies. And so anyways, I'll send you that link when I send out the other information. But truly, Kim is phenomenal. And one of the things that I want to highlight here is that research shows that babies can be saved if expectant parents are educated about tracking their baby's movement and immediately reporting any changes to the baby's movement pattern to their healthcare provider. When I talked about that, 32% reduction in the stillbirth rate in Iowa, and one of the things that we can't exactly correlate that to Count the Kicks because we don't have the research on that yet. We're working on that. But what we have heard, and what, Kim Piper, the former director of IDPH, and what all these public health leaders have said is that there has been nothing else going on in Iowa that would significantly impact the stillbirth rate like that. It's not like there was a program to make sure every pregnant woman got a doula or a midwife, or, smoking rates have gone down. In fact, smoking in women has gone up, or obesity rates have gone up and things like that. So research and evidence, I don't spend too much time on this. If you take the CE training, which I'm giving you for free, it's online. I'll give you the access code and everything. But this is the research article that started it all. And on the CE training, we ask you to actually read it and ask several questions around it to be a little bit more interactive. But I pulled out a quote from Dr. Ruth Fretz. She was one of the primary researchers on this Norway study. Remember the Norway study that started this entire project. And she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. She's also on our medical advisory board. She's a phenomenal expert in this. She's one of the top in her field around stillbirth prevention. And so we really value her input and assistance. And so a couple other research studies are on here. The reason I'm telling you this is to truly show and tell you that, this isn't just something that was one and done. It wasn't one research study. It's been a lot of different studies and a lot of different research. This is truly an evidence-based campaign that we did. We just created the tools and systems for pregnant women to feel comfortable and to understand their baby's normal. So let's get into the meat of it, the implementation of Count the Kicks, especially in your line of work. And so first, just as a refresher for those of you who are very familiar with it, again, this is evidence-based, it's mom-focused. The founders truly wanted a campaign that would be empowering. We all understand and know how sad and dark stillbirth can be and is. And so the founders especially knew this. And so they wanted to create something that was empowering, gave, providers and others the tools to easily talk about this. This should be talked about just like any other issue with pregnancy. When you're going through your blood, your glucose screening, all your blood tests in the beginning, where you talk about all the different issues, the chromosomes, all that, this should be talked about. And so what this does is educates women on the importance of tracking fetal movement. We have the app and we have paper charts, and it empowers moms to speak up to providers if they notice a concern. So the Count the Kicks app is free. If you haven't downloaded it yet, I suggest you take out your phone right now and download it. You can search it in the App Store or the Google Play Store. Just search Count the Kicks and you'll see the little yellow icon come in. I really want you to download it because I think it's very important that you become familiar with it, because you are going to be the one talking to your expectant parents about it. And so how amazing is it that you could just pull out your phone and say, I've been working on it, I've been using it, this is how easy it is. It's available in those 12 languages that you see there: Amharic, Arabic, Chinese, English, French, Haitian Creole, Hindi, Marshallese, Russian, Spanish, Swahili, and Vietnamese. I list all those out for you, one, because we're such a great melting pot of individuals. And so you, as you're working with individuals and families, if there's a language up there you don't see and you have a high population of a specific group that needs it. So I'm working with Burmese right now to try to figure out to get it translated into Burmese. I want to know about it because, like I said, and I'll say multiple times because we couldn't do this without you, is you're the boots on the ground. So we need to know what we need to change or add to make it applicable to your population that you're working with and educating on. So please let me know. I'll find funding. I'll find grants to get it translated because I want this to be for everybody. Users can share kick session results on social media. They can send it to their provider. And in a time with COVID where we're unfortunately seeing several prenatal visits go, stretch out or go to telehealth, this is a great tool for moms to say, hey, I just emailed you my kick session data from the last week. I'd like you to look at it. Let me know if you see anything or anything like that. Or can they send it directly to you? And so we also do push notifications for reminders. We highly, highly recommend that people set up reminders to count at least once daily. We are busy, we're home, we have kids at home, we're working from home, we're trying to do a million things in this crazy COVID world, right? Even when COVID wasn't around, we were busy. And so it's easy to forget to sit down and really focus on baby. Thanks, Amber, for the comment. She said, I see a ton of Burmese pregnant women who have no primary care provider, so that would be amazing. That's great to know. Thank you. I'll write that down. And then we also have our post-pregnancy survey. And this is something new that we implemented last November. It's called, I call it like the finished pregnancy survey, basically. So once a due date has passed, the app will ask mom if they've had their baby. And if they've had their baby, we ask them to fill out a very, very quick survey that really gets to how the app made them feel. Did it make them feel less anxious, more anxious, bond with baby? Did they notice reduced fetal movement? And then what was the next step? Did they contact their provider and what their provider did? So go through a couple times and finish a pregnancy and fill out the survey so you can get used to those questions and just understand those questions. We have had over 3,500 people fill that out in less than 9 months. And this is going to be a fantastic tool for us to understand and get to know how our users are feeling. And I can tell you overwhelmingly, just by looking at the preliminary data of these reports, is that I can easily say 95 to 98% of users have found that it makes them feel less anxious and bond with baby. And this is amazing. This is what we want to see. And so when you've downloaded the app, which hopefully you just did while I was talking about it, all you do is you create an account and then you set up your pregnancy profile. And so you can set up as many pregnancy profiles as you want. I have like 80 in there because I'm always testing the app on different twins and singles and things like that. And you just tap the little foot when you're ready to start counting, and a timer will start. And then every time mom feels a movement, she should tap the foot and until it gets to 10. And then what it will do is, I'm gonna fast forward here, I should change my slides around, but you see that graph there on the left-hand side of your screen. What the app does is it starts to show you this graph, and then after about 5 sessions, you really start to see the trend and the pattern of the baby. Around 24, 22, 23 weeks, babies start to get in a pattern of movement, and we recommend starting to count if you're high risk 26 weeks, if you're not high risk 28 weeks. And so you can see by this baby takes about 15 minutes to get to 10 movements. And what this does is it shows mom that's her baby's normal. And what's really important about it is that we want moms to understand what's normal for their baby and to understand every pregnancy is different and every baby is different. So my baby might take 15 minutes to get to 10 movement, and my friend Sarah's baby might take 30 minutes to get to 10 movements. She knows 30 minutes is normal for her, and I know 10 to 12 minutes is normal for mine. And so let's say one day I'm counting and all of a sudden it's getting to be like 35, 45, 50 minutes. I'm going to call my provider and say, it's taking a lot longer than normal. It's normally 10 minutes, what's next? And we don't pretend to be medical providers. We work with a lot of medical providers, so we can have accurate medical information, but what's next is they go into their provider, they talk to their provider about next steps. A lot of times it's the biophysical or the non-stress test to just make sure baby's okay. And so what you want to do when you're talking to expectant parents is we want to empower moms to speak up if they notice a concern, especially right now in the time of COVID. One thing that we're seeing, at least internationally, and that we're trying to stay up on here is the stillbirth numbers have dramatically increased in the UK during like lockdowns and COVID because moms are afraid to go in. And so we cannot have that happen here. And so we really want to stress to moms that you have less likely of a chance of catching COVID than something happening to your baby for that. And then really making sure that they understand who to call, especially if you're working with a lot of refugee women, or, you know, English isn't their first language, or they have trouble at, you know, understanding the healthcare system. We need to make sure these women who are very high risk really truly understand what to do, what's kind of their action plan. It's not to overwhelm them at all. It's to empower them. And that's where you guys come in. And so we're going to get to a little bit more of your role in this. And so have a kick session, download the app. You can do so much with this. You can share with your significant other. You can look at FAQs on the app. You can, like I said, send to your provider. There's the paper chart right there that you can access on our website. You'll also be getting a couple copies in the toolkit that I'm going to talk about here in a little bit, along with the wristband that I'll show you. Okay, so Count the Kicks for enhancement of care. This is you guys. So we know about Count the Kicks, right? We understand the importance of it. We know about the app. We know about the materials. So what's your role? So you already have this captive audience. You are bringing awareness to oral health already. And we want to connect those dots, right? We know that there's no denying the connection between poor oral health and poor birth outcomes. You guys know this. You're the experts in the oral health. So let me give you the tools and resources on stillbirth prevention to incorporate that into your system. You can truly integrate Count the Kicks into not just traditional healthcare settings like the OBGYN, but to dentists, hygienists, dental assistants, and you. I remember when I was pregnant with my second, I had just found out the night before and I had a dentist appointment the next day. And, you know, one of the first questions are, has anything changed? Are you pregnant or trying to get pregnant? And I was like, actually, I just found out. So if you're working with dentist offices or WIC clinics or other maternal health providers, make sure you're talking to them about this. They might have heard about it, but are they actually implementing it correctly? Are they asking the open-ended questions? Are they asking at every visit? And then ask your expectant moms, like, put it on them to say, talk to your provider about this, talk to your dentist about this. You're probably seeing your moms a lot more often than even if they don't have a primary care provider, like Amber had said, than any other health professional. And so you can play an integral role. And this is why this is such an exciting opportunity for me. And I think Angie, it's truly a first of its kind initiative. And I think we really have the opportunity to make significant systemic change with this and save babies. So I kind of got on a tangent. I'm really excited about it. So let's talk a little bit more about this coming up. So just keep that in the back of your mind. So we're still maybe a little uncomfortable talking about stillbirth, right? Like we haven't really gotten to that point of where we feel comfortable about it. So some things that might be going through your heads, or if you're taking this back to people in your offices, you don't want to scare moms, but remember what I talked about earlier. Pregnancy is full of risks that we talk to moms about. Stillbirth is another risk that moms deserve to be educated about. I don't want to tell too many personal stories because we only have about 15 minutes left, but I do want to share this one because this one always stands out in my mind. I was talking to a woman who lives over in the Dubuque area, and she had a stillbirth, I think a year ago. And she had said, she's like, I don't understand why nobody told me about this. And as I was going through, if you haven't been pregnant before, a lot of times when you go into your first appointment, a lot of providers will give you like a binder of everything you need to know about pregnancy, breastfeeding, everything. It's very overwhelming, honestly, as for first time moms. Well, anyways, so this mom was telling me how after her stillbirth that she was going through all of her pregnancy stuff and she had found this binder. And she said right there in, one of the pockets was a brochure, and that was it. It was just a brochure. Nobody talked about it, nothing. I didn't look through it because nobody pointed it out. Had somebody said to me, this can help prevent stillbirth, that would have said to me, a light bulb would have went on, and I would have been like, what? Like, tell me more. And I think that's how every single expectant mom would feel. So we need to talk about it. We need to move away from this taboo topic or feeling like it's taboo and talk about it. Stillbirth just happens. There's nothing we can do. There can be warning signs if moms know what to look for. This is what I hear a lot, and this is probably what you're going to hear when you're talking to moms. Her baby's always active. It's not a concern. You're going to talk to moms about tracking movement, and they're going to say, my baby's always active. They keep me up at night. I don't need to track baby movement. And I think it's really important to understand and to let mom know, that's great. I am so glad, because a healthy baby is an active baby. But just remember that babies can be active until they aren't. Cord and placental accidents can be sudden, and moms need to know what's normal. And that's the caveat. They need to understand what's normal for their baby. So let's say you have an active baby and you know you get 10 movements in 5 minutes. That's super active. That's how my sons were. But then the next day you're trying to count, and, life got in the way. And so you finally sit down and count, and you're like, oh, it's taking 20 minutes. It's taking 30 minutes. Is that how long it normally takes? Or was it 10 minutes? It takes that guesswork out of knowing that. So it just gives moms that extra point. Plus, we know, we're doing research on it right now, and the preliminary research says this helps moms bond with baby and feel less anxious, and it includes the entire family unit. And so there's no reason not to do it. Here's one. I don't think your moms might say this because they might hear it from, like, think back generational. It might be it's an old wives' tale. She's almost at her due date. The risk of stillbirth actually increases as she approaches or exceeds her due date. So again, maybe here's some other misconceptions you might hear while you're in the field and talking to moms. It's that moving less closer to the due date. That's a myth. And they might get that. I got that from my grandma when I was pregnant. Oh, baby won't move that much. And first time moms might question this a lot. Babies do not move less. They just might move differently. You may feel less sharp kicking and more rolling. But again, if they're monitoring the baby's movements at the same time, it should take about the same amount of time to feel those. Here's the active one again. Active babies can also experience distress, sometimes quickly and without other warning signs. Here's a big one that I really, really, really want you to remember, because in this time of COVID, I'm nervous we're going to start seeing this more and more. I can hear baby's heartbeat on a Doppler device, so I do not need to worry about movement. A change in baby's heartbeat is one of the last things to occur when a baby is in distress, whereas decreased movement is an early sign. Not to mention, if they are not trained on how to use a Doppler, the potential of hearing their own heartbeat versus the baby. We do not want moms using home Doppler devices. We do not want them downloading apps to use it. We want them to track movement. Baby's just getting ready for birth, running out of room. Again, this might be something if you're working with families that are, generationally living together. Baby should continue to move up to and during birth. Here is a more recent one. Mom should get 10 kicks in 2 hours. This is actually a common misconception and actually outdated. What research now states that moms should be focused on fetal movement in general and understanding their baby's pattern. There is a research article on our website that talks about this in more detail. I don't have time to go into it today. Basically what it says though is if we don't want to put a time limit on it, right? Like, because if my baby usually takes 20 minutes and then the next day it takes close to 2 hours, but I'm like, hey, I got my 10 movements in at 1 hour and 58 minutes, I'm fine. That's not normal for my baby who normally takes 20 minutes. And so it's a very interesting research article. And I think providers say the 10 and 2 because it's easy and quick to remember, but we really want to talk about the normal, what's normal for your baby. So how do you talk about count the kicks? Again, 26 weeks if high risk, 28 weeks otherwise. We have a lot of resources online. We have childbirth ed classes, preparing for birth. We have different samples of how to incorporate that into any other class. I think you could take bits and pieces of it as you're doing outreach. Asking questions like, do you know about the importance of tracking your baby's movements? Let's talk about how to track your baby's movements. Share how movements are jabs, rolls, push-ups, anything but hiccups, and then share the app. Remember to stress the importance of knowing their baby's normal and speaking up if there's a change. Make sure mom knows what's number to call, have her write it down, send her a text with the number if you need to find it, have her put it in her phone, send the brochure home. Share with mom, research shows evening is usually the best time to count baby's movements. That's usually when, they're most active a lot of times, but I know people work third shift. And so I don't want that to be a barrier for moms to do that. So they just need to pick a time and stick to that. And hopefully it's, you know, a time that baby's most active. And then start talking to them about it. Tell me about your baby's movements. Every time you talk to them, put it into your paperwork that, you know, the third trimester, you know, mom's at the third trimester, you're going to start talking about this. Can you show me your app? Can you show me your graph? What questions do you have? You guys are all knowledgeable now on this, that you can easily answer these questions. And we have a lot of great resources on our website. And so, let's see if this works. We'll see if this one works, but this is a great video to show your moms. It's super short, but it goes through, unfortunately it's only in English, but it does go through how to use the app. So let's see if it works.
Count the Kicks is a great way to monitor your baby's well-being, which is why many doctors recommend making this part of your daily routine at 28 weeks or 26 weeks if you're high risk. It's easy to do using our free Count the Kicks app. Just pick a time when your baby is active, preferably the same time every day. Sit with your feet up or lie on your side. Count each movement as one kick by tapping the footprint on the screen, and the app will show you how long it takes to reach 10. You'll soon get to know what's normal for your baby. If you notice a change in the strength of your baby's movements or how long it takes to get to 10, contact your healthcare provider right away. The Count the Kicks app is free and available in 12 languages. Our app makes it easy to track and save each day's kick counting session. You can even email or text your sessions to your provider or family. Don't delay. Visit the App Store to download Count the Kicks today. And remember, every kick counts.
Hey, look at that, it worked. Super pumped. Okay, we only have about 10 minutes, so I'm gonna go kind of quickly, but yet slow, because this is your part. So I Smile on stillbirth prevention. Let's connect the dots that we talked about earlier. When we talk about connecting the dots, what does that mean? How are you gonna do this? How are you gonna incorporate this into your program? I think there's a lot of great ways, and I am open to other ideas. I'll do a survey after this, an evaluation sort of, but I want to hear from you. After you hear this information, what else could you do? Because I truly think this could be a white paper, it could be an abstract, this could be huge. And so first, participating in this webinar, doing the online training that I talked about, becoming familiar with Count the Kicks and stillbirth prevention, that's huge. That's one of the first things you can do. I firmly believe that knowledge is power, and you guys have that around this system now. Download the app, make sure you become familiar with it. Utilize the toolkit that's going to be sent out. That's going to have a lot of great tools and resources for you. I'm going to talk about in the next slide. And I would love to know what else you want to see in that toolkit, because I am not in your shoes. I do not know how often you meet with provider or patients, especially now in COVID. Is there something electronic that you need? We do have an academy for providers and parents that really goes through telehealth features. So like all the videos you should send your moms, things like that. And so what are you already, or who do you already know in the community that should know about this? Connect them with me, you connect to them, reach out to them, share the brochure, share these posters that we created specifically for this campaign. It's really cool. I'm going to show you on the next slide. You see expectant women far more than they may even see a provider. Or again, like Amber, I need to know where you're from, Amber, again, because that's alarming. You know, these people, these individuals who do not have any prenatal care. Can you integrate this into your intake or systems protocol? Absolutely. I am very, very passionate about systems change. Anything that you can do to incorporate this, to make it easier for your entire staff to participate in, and to keep it cohesive. So just adding questions like on your intake, or some sort of like 6-month check-in, or just as you know, women are getting pregnant, and talk to them first about making sure they have a provider, make sure they have prenatal care. And then as they go on throughout their pregnancy, do you know about the importance of not just brushing your teeth while pregnant, but also tracking your baby's movement? Let's talk about why you should track your baby's movement, just like why you should be brushing your teeth. You're already such a great mom by taking care of your teeth. Here is another way you can be a great mom and bond with baby. These are just a couple tools, a couple things that I wanted to share with you of how you can kind of start that conversation, because I think that's kind of one of the barriers where it's like, oh my gosh, how do I even bring this up, right? This is how you bring it up. You have these materials, you have these resources. Here are your options, just a couple motivational interviewing techniques. So again, thanks to this partnership with Delta Dental, we will be sending you all a toolkit. This is what is coming in it right now. So on the screen, you'll see the counting wristband. I'm going to be sending 25 of those out to you. And this is a really big pilot, these wristbands. I also sent it to the McVie, the home visitor contractors, because we're really trying to gauge with, especially in Iowa, where the majority of Iowa is so rural and birthing centers are closing right and left, and how many moms live outside of broadband, they live 60 miles from a provider. If they don't have a smartphone, or they're teens and they don't have access to a smartphone or an app, this band, all you do is you wear it and there's a little slider on it. And so all they have to do is when they're ready to count, they'll use the paper chart, but they'll also slide the band it goes 1 through 10. And so there's kind of a how-to that will come with it for you guys to review, so you know how to talk to your moms about it. I'm also going to be sending regular Count the Kicks brochures within a partnership with IDPH. You can order as many brochures, posters, etc. that you want from our website. It's completely free. With one little caveat, the brochures and everything, but the brochure or the poster you see on the screen, that was made specifically for this grant. So that is not for order on our website. That will be coming to you in our toolkit. So I've asked for you to fill out a survey. I have the link in here, and I'll send it again when I send this out if you haven't filled it out, of kind of the quantity you need, and I'll try my best to get that to you, and then I'll have enough to get you more should you need more. I know a lot of you probably are not going out and going into clinician offices or WIC clinics and things like that, but as you start to go or feel comfortable and you're wearing your mask and everything, this is what I want you to put these posters up. I want you to put them in your offices, share them at dental offices, things like that. Toothbrushes, they're coming from Delta Dental, and then some FAQ helpful tips, frame magnets, which is this, and it looks a little busy, but what you do is you kind of pop out the middle section, and then the outside becomes a frame. So moms can put their sonogram, they can put notes, they can put pictures of their children. So again, you're going to get the posters. Please share with your contacts, WIC, dental offices, community agencies, Head Starts. Toothbrushes, share those with your expectant parents. Count the Kicks should be involved with the whole family, you know, involve the siblings. Let's sit down and feel your brother move, you know, type of thing. The magnets should be used, you know, with your moms and significant families. The band, education materials, and then here's the survey link again. I'll send it out. If you already filled it out, I have your information. I did notice a couple notes in the comments, so I got that. So I will get you all what you requested or close to what you requested, and then you can always contact me or Angie if you need more, and we can talk through that. So really quickly, because we're really close on time, and my apologies if you need to leave, I understand. Implementation of Count the Kicks into your appointments and meetings. So everything that we've already talked about, you're becoming familiar with it. You have ordered the material, you're going to be getting the material. Take the free CE training. I'll give you the coupon code in the email. Make sure everybody knows about this that you're working with, and then integrate into the notes and systems. Here's a really big one, especially for those of you who are working with families that might be living together with grandparents and things like that. Stress to parents to trust their instinct. If mom feels concerned or that something isn't right, call the doctor. So many times we've heard moms say that, and then grandma might say, oh, you're fine, baby doesn't move much. Then mom starts to second guess herself. So make sure mom and significant other, anybody that she's around, you know, trust her instincts. Share that sleeping lying on their left side is best for them and baby. If they should wake up on their back, it's totally fine. Just flip to your side. Review the common myths. I would love, love, love to learn what you're hearing from your moms regarding common myths that I need to update. Because like I said, you guys are the boots on the ground. And then discuss plan of action if mom noticed reduced fetal movement and how long her drive is, what she should do, the number she should call. Just kind of like you know, my daughter has asthma and we have an asthma action plan. And so this is kind of what it is. It's not to alarm mom, it's to make mom feel empowered and prepared and confident in her ability to trust her instinct and to know what to do. So a couple other additional resources. These are things that you can actually order right now on our website. We have our promo posters in English and Spanish. Everything is in English and Spanish on our website. And the new, which you'll also be getting in your toolkits, are these, I can't remember if you're getting these. I'll have to double check, but I can send them. Low literacy materials, and that's on the top of the page there. That's for, like I said earlier, where English is not their first language, refugees. It's just a lot less text and a lot more pictures, obviously. So again, go to counttthekicks.org, click on order materials. I'd be remiss if I did not talk about COVID, a little bit more detail. We have really done a good job of getting the research and providing factual evidence-based information on COVID-19 and pregnancy on our website. And so go there if you have additional questions around that. We have some great videos that you can share with your mom. Again, we do not want moms to feel scared to go see their provider because of COVID. If they think something's wrong, and that goes for anything, whether it's, unusual discharge, bleeding, terrible headaches, blind spots, anything like that, they have got to contact their provider and go in if they feel like if they can't get through to their provider, walk in and go into the ER and get checked out. We have these Count the Kicks academies for providers and parents. Check those out on our website. And then coming soon, a page that will be truly dedicated to oral health and pregnancy and connecting those dots to stillbirth prevention. And you guys will be referenced on the page quite a bit. So I'm glad you're taking this, so you know all that. And then final last steps is ordering the material, utilizing the toolkit. I'll send out surveys. I want to know how it's going. I want to know what you like or don't like. I want to know what you want added, because we still have time, because I'm still getting them created and getting the magnet in and everything like that. There's a CE training, baby safe stories. Go to our website, because I'm going to do a really quick poll again. How do you feel comfortable integrating CTK into your research now? So let me see if I can find the next one. Oh, we did that one. No. Oh. Well, I can't find it now. Oh, here it is. Okay, I got it, guys. Okay. Do you think Count the Kicks is something you can easily implement and integrate into your flow of work with your expectant parents? It's completely anonymous. If you don't feel comfortable, you're not sure, that's totally fine. Great. So the majority of you said yes, which is awesome. I'm so glad. I hope you found this beneficial. I'm sorry I went a little over my time. I will stay on longer if you have questions, if you want to talk about the toolkit, if you want to go over something again, feel free. Use the chat box. I'm not sure I can hear you. And I'll try to figure that out, but otherwise you can use the chat. Thank you, Angie, for all your help and assistance with this. We will be doing another webinar tomorrow at noon at the same time. If you'd like that information, let me go back to my contact information. Feel free to let me know. Maybe you have somebody at your office or staff that needs to hear it that hasn't signed up. By all means, I can send them the link to register. So with that, I am going to leave it open for questions or for you to take off and enjoy the rest of your day. Let's see. Oh, I think I hear somebody. I think I can actually hear you now.
Can you hear me, Megan?
I can. Yay.
So, I just wanted to share a personal story. My daughter will be 21 in a month from today. And I had a complicated pregnancy and was on bed rest at 26 weeks due to amniotic fluid issues and all that. And Dr. Monsager was actually my high-risk provider. And I had to have the notebook and pen by me everywhere I went to document the kicks. So I think this is amazing to have it available, on a phone. And we've promoted it a ton, because I just think of how much simpler that would have been for me almost 21 years ago.
So she's 21 now, you said? So did you
be 21 in a month from today.
Okay.
So.
Did you have her did she make it all the way to full term?
No, 36 weeks.
36 weeks, 36 weeks. Almost though, almost. That's awesome.
Yeah.
So Dr. Monsager, yeah, he's been around. He's one of our best. I mean, we just love working with him. He's so fantastic. And that's so funny. I'll have to tell him that next time I won't say your name, but I'll say, I talked to a woman
Yeah.
who delivered her daughter 20
Long
years ago.
time ago.
But you knew about, I mean, that's just shows you that we did not invent kick counting, right? And what you just said, like, you wish you would have had this 20 years ago, because this is so simple and easy to use and to share with your moms. And the more we can share with moms, the more touch points they have. And maybe they'll say, oh my gosh, I've heard this from my provider. Great, keep talking about it. Like, there's no such thing as too much, right? Like, this is just what you want to touch upon. And their providers should be asking them about monitoring baby's movement and, you know, kick counts at every single appointment in the 3rd trimester. That's something that we're really trying to change and hone in on, and really encourage moms to step up and say, hey, let's talk about this if they're not being asked about it. So thanks for sharing that, Paula. Anything else? Anything else anybody wants to share or ask, or toolkit ideas, your thoughts on that? If not, you just have to
Thank
unmute
you guys for
yourself.
all your work.
Thanks, Paula. Congrats to your 21-year-old. That's a fun time. That'll be a fun birthday.
Yeah, she's in nursing school right now, so it's been challenging, but
yeah, I've heard that's
still
super
she'll do
hard.
it.
Yeah. Yeah, that's awesome. I'm so sorry for all the technical difficulties and headphone issues too. I am glad I didn't lose internet, and my son only came over to me once or twice to ask about a Lego piece, and I was like, go ask your dad. So you tell him so much. You're like, I'm literally doing this for the next hour. Don't talk to me.